Hello everyone, welcome back. Let's do another question and answer session where seemingly I learn as much as you guys, so that's great. Let's do it.
Okay, the first question is, how long typically are plus size tummy tuck surgeries?
Length of time, about 4 hours, give or take. Not all plus size tummy tuck patients are the same. So the amount of liposuction that we do in there varies. The length of the incision, sometimes we need to do a vertical incision as well. We find hernias in there, scar tissue from other surgeries, so that all impacts it. I would say most plus size tummy tucks are somewhere in that 4 hour and a half range. Some of them will go up to about 5, maybe even like 5.5, but about 4.5 is the average.
Okay. The next question is also about the tummy tuck procedure. And Zarzi wants to know, if a tummy tuck or full body liposuction, which one takes the most time to recover?
Well, so a tummy tuck is a removal of skin from your abdomen. So when I do a plus size tummy tuck, I also liposuction the abdomen, size of the abdomen. I do a pubic lift, pubic liposuction, muscle repair if needed, hernia repair if needed. Basically do everything that I can do with my knowledge and skills that your body allows me to do. So it's kind of a complete overall procedure. I don't like piecemealing my tummy tucks. Now, whole body lipo means a lot of different things. So for most people, what they really mean is liposuction of the waist 360 all the way around. So if you're considering one versus the other, I think the recovery is going to be fairly similar, maybe a little quicker on the top end for the liposuction. But the first 2 weeks are going to be the same. Basically, you want to just rest, drink lots of water. You're going to have a drain with both of them for a couple of weeks, no matter what. And you want to wait to work out for probably about 6 weeks with both of them. So that, in those terms, the recovery is about the same. In terms of maybe after that 6 weeks, you're probably going to get back to full activity a little faster with the liposuction because there's no incision there. So I think liposuction 360, maybe after 6 weeks, your full-on recovery is just a little quicker. But if you have loose skin, liposuction of the waist 360 doesn't address the loose skin. So that's something for you to consider, because that liposuction of the waist may not be a great idea. People with loose skin on their waist, usually obviously loose skin in the front by your pubic area, loose skin in the bra area in the back, usually need a bra line back lift for the back and a abdominoplasty for the front. And then at least for my patients, they automatically includes a liposuction of the waist 360.
Okay, so kind of a similar question from Two-Tone Adonis. He wants to know if he has excess skin from weight loss, if he should consider getting lipo done separately before getting excess skin removed to maximize the amount that can be removed.
I don't think you have to. Now, some surgeons will have preference. Well, they say, well, I don't do skin removal and liposuction at the same time. We stage it. You can choose one or the other. I don't have that perspective on it. I think you can do them at the same time. So you have to look at each individual person from case to case. But I don't think you have to wait. I think you can do both of them at the same time.
Okay, thank you. Our next question is from Renea_16. She would like to know, how long after a consultation will you be able to pick a surgery date?
You can pick a surgery date anytime you want. We have some patients that will pick a surgery date before they even do a consult, which is pretty rare, but most of the time you'll pick a consult date, you'll do your consult, and then you can choose your surgery date. But it doesn't make any difference. You can, if you know that you want to have surgery and you compare yourself with some of our cases and you think, well, this is the surgeon for me, and I know I'm going to have surgery, and you have a specific surgery date in mind that's, an important date for you, then you can certainly book it ahead of time.
Okay, great. And then our next question is from MDM Chick. She would like to know, what are the best questions you should ask during your tummy tuck consultation?
Well, it's almost like interacting with any business. You want to ask, are you the person that's most qualified to give me the result that I'm looking for in whatever business interaction that you're doing? So when you interact with your plastic surgeon, it's like, okay, I'm looking to have a plus size tummy tuck. Do you do high BMI tummy tucks? And by that I mean BMIs of 35 or 40 or greater. And if they say no, then That's, that's the first question right off the bat, right? And if they say yes, they're like, okay, great. Well, how many of these do you do? Great. 1 a year. Great. Is that comfortable for you? No? Then obviously go to someone else that does more. And then the next question, okay, well, let's look at your results. And so are the results of your high BMI tummy tucks that you do consistent with the results that I'm trying to get? And if they are, then great, then move to the next one. Being a board certified plastic surgeon, very important, because that's most likely going to be the person that's going to answer all the questions yes, right? And then the next question is, where do you do your surgery? Is it a credentialed facility? Yes, great. And do you have a board certified anesthesiologist? Some surgeons will use nurse anesthetist. There's nothing wrong with that. But if you're doing complicated, challenging cases, you really should, in the ideal circumstance, really have all hands on deck with everyone being as trained as possible. So we use a board certified anesthesiologist, fully credentialed facility.
Okay, great. And then our next question is from Michaela Martinez, 262. They would like to know, does the amount of pregnancies affect your tummy tuck procedure?
Not necessarily, although if you have a lot of pregnancies, chances are that you have loose abdominal muscles, separated muscles. But I include muscle repair in my tummy tuck, so that doesn't really change anything. It probably results in having stretch marks, but that's what a tummy tuck does. It removes the stretch marks that are in the excision part there. Pregnancies doesn't really change the process of doing tummy tucks unless you're going to a plastic surgeon that doesn't automatically include like muscle repair. In that circumstance, that might impact that.
Okay, great. And then our next question is from Jessica_J. They would like to know, would you be able to get a plus size tummy tuck as well as a breast augmentation with implants at the same time?
You can, yeah, and we do that all the time. We do long multi-procedure surgery. So we'll do like bra line back lift, tummy tuck, breast lift with augmentation. Obviously, some of these, when you start doing that many things, that they ends up being quite long. 6-hour cases are kind of average for us. 8 to 10 is pretty common. We don't do very many 12-hour cases. I used to, but I'm 47 now and I've been doing this for 16 years, and 12 hours is starting to be a little bit too much for my body to take. So we tend to kind of chop them off at 10. Periodically we'll do, 12-hour cases, but those are primarily facial rejuvenation cases. 10, 12-hour cases tend to be facelift, neck lift, things of that nature, because physically I'm not doing quite as much mechanical movements.
Okay, and a quick follow-up question to that. Would you be able to do a tummy tuck and an arm lift at the same time?
Yeah, I think over the last week, that's basically all we've done. I think we've done basically every single day we've done a tummy tuck arm lift or a tummy tuck bra line back lift arm lift or some version of that. So it's interesting that you asked that question because I think that's basically all we've done for the last 2 weeks.
Mm-hmm. Okay, great. And then our next question is from Jordan Keller Matthews. They would like to know, what do you use to treat cellulite? Is it Avili?
There is no significant and permanent treatment for cellulite, unfortunately, at least according to my humble opinion, in terms of my knowledge of what's out there. There's 2 types of cellulite. There's excess fat cellulite and excess laxity cellulite. And the problem with both is the ligament that suspends the skin to the muscle. And of course, the excess fat cellulite pushes the skin beyond the stretchiness of the ligament. Excess laxity cellulite is when the laxity of the skin gets pulled down by gravity, and then the ligament then pulls up on the skin. That's why for excess laxity cellulite, when you're standing up, the cellulite's noticeable. Maybe when you're laying down, the cellulite's not noticeable because you take the gravity out of the equation. And there's no current technology to really fix that. In the ideal technology would have some mechanism of shrink wrapping the skin back, and we don't have that. If we did, then we wouldn't be doing arm lifts and face lifts and tummy tucks and things of that nature. Now, excess fat cellulite, you can liposuction. You can debolt the fat, and that should make the cellulite look better.
Okay. And then our next question is going back to the surgery center from Peter Pace. They would like to know, is it important to have a license to do your plastic surgery in a hospital versus in a private surgery center?
In terms of licensing, there's two ways to look at licensing, and I'm not sure which way you asked that question, but I'm going to answer it both ways. Either way, if it's a surgery center, you want it to be a fully licensed surgery center at the highest grade, because that means the credentialing body, whether it's J-code, Triple HC, Quad ASF, or state licensing, requires the surgery center to perform the same emergency protocols as the hospital. And that means that if there is a situation there of emergency, then you have all the training, all the protocols, and all the equipment and supplies to manage that situation. Whether you have, so that's the answer for the licensing for the surgery center. In terms of licensing for the doctor, all doctors are licensed as a doctor. If you're an MD, then you went to the training, you're licensed as a doctor. Now, if you operate in a hospital, they will not let you be like, let's say, a family practitioner doing a tummy tuck in the hospital, because they understand that a family practitioner doesn't have the training to do a tummy tuck. Now, a family practitioner can theoretically, depending on state regulations and whatever state they're practicing, can theoretically start their own surgery center and then operate in that surgery center. So a couple of different ways to look at that. In the ideal world, you go to board certified licensed plastic surgeon, and you have your surgery either in a hospital or a fully licensed surgery center. There's not a lot of good black and white between hospital versus surgery center. I think in a surgery center, especially if it's run properly, the surgeon has more control, because the hospital has to do a lot of different cases by a lot of different surgeons. That's challenging to do. And in a surgery center, like in my surgery center, all we do is plastics, so that we just do the same type of surgery.
Great, thank you. Our next question is from CBM. They would like to know, do you recommend lymphatic massages immediately after surgery, or do you recommend them at all?
Well, it depends depending on what kind of surgery you have. So you have to remember, anytime you do surgery, you're creating some tissue damage. So let's say you do liposuction, then you have these cannula tracks through your subcutaneous tissue. And so ideally, your body wants to collapse and heal those. So massaging super early, you're kind of defeating that purpose a little bit. When you do a dissection procedure like a tummy tuck, you're dissecting the tissues and you want now the whole tissue to seal back down. Doing lymphatic massage early on, you're disrupting that process. So I'm a big fan of waiting for that process to seal back first, and then you can do lymphatic massage. I don't necessarily think you need lymphatic massage. It's a preference. I definitely recommend not doing lymphatic massage earlier than that tissue healing.
Okay, great. And then the next question is from supathick_31. They would like to know, what is the highest BMI of a person you've done a plus size tummy tuck on?
84. 84 is our highest BMI tummy tuck. We did that maybe 6 months ago, maybe a year ago. She did great from the East Coast. Healed great, no problems. BMI is just one number, and it's made up of two numbers, your height and weight. So it doesn't tell us too much. We got to look beyond that. And so, we have high BMI patients that are not healthy enough to undergo surgery. And then we have low BMI patients that are not healthy enough to undergo surgery, and vice versa. So BMI is just one data point. It's important to look beyond that.
Okay, great. Our next question is from underscore gotta love me 89. They would like to know, is it possible to be very healthy but still considered overweight?
100%. Yeah, right. So let's say you're overweight. And so overweight from a BMI standpoint is more than a BMI of 25 for a woman, right? And I think it might be 20 for a guy, or some version of that. So you can imagine, in our culture in the US, most people are overweight, right? There's few people that have a BMI of lower than 25 if they're women, and lower than 20 if they're guys. So most people are overweight. Now, there is a range where you can be overweight and your body's physiology is still good. But the other component is what is your body made of? Because a CrossFit competitor is going to have a BMI of higher than 25, right? So CrossFit competitors, because of the muscle bulk, might have a BMI of 30 or 35, right? So, and they're going to be like the healthiest person on this planet, right? They're exercising all the time. They're eating clean. So BMI, overweight, and health are not necessarily connected. It all depends on what you're putting into your body and how your body is dealing with that. Because you can be a BMI of 20, let's say, and that means you're not overweight, but you can be eating chips and soda all day long, and so your body can actually have pretty bad metabolic dysfunction. You can have diabetes, your cholesterol could be way off, you can have hypertension, you can have kidney stones, you can have your electrolytes could be way off, your hormones could be way off. So health is a holistic version. We have to look at the body overall. So weight, BMI, overweight, all that stuff doesn't really tell us much. You gotta dive beyond that.
Okay, great. Our next question is from Jennifer underscore psychotherapist. They would like to know, can you do lipo in the abdominal area even when you had a previous hernia repair?
Yeah, I'll do liposuction even with the presence of a hernia. I have to identify where the hernia is and I have to work around it. But if you're just starting out as a plastic surgeon, obviously you're not going to want to do that, right? Or at least do less of that. But as you get higher and higher skill and higher knowledge, you can get that range of what you're doing a lot tighter. So we've had patients in with hernias. We know where they are. We identify them. We lipo around it. We do all that stuff. Different types of cannulas, different types of procedures. And then by feel, you know a little bit more of where you're at. But yes, prior hernia repair, liposuction should be safe. At the same time, if you're not consistent and safe with your protocols of how you do liposuction, you can do liposuction on someone with no hernia and you can penetrate the abdominal wall and you can injure that person. So the surgeon has to be responsible for that.
Okay, great. And then I have kind of an interesting question from Leslie Andrea 2013. She would like to know, are transfusions needed a lot with your tummy tucks?
We've never had to transfuse any of our tummy tucks. We've never had to transfuse any of our patients after a procedure. The people that have had transfusions have always been like 2-3 weeks out. And it's always been from patients that have done large volume liposuction. So what happens is the inflammatory response and the fluid shifts from a large volume liposuction, we're talking about 15 liters, results in an impact to the body's creating hemoglobin. So in the beginning, like right after surgery and in the first post-op, they're like, I feel good. I mean, I'm sore and I'm a little tired. And the second week out, they're like, I'm kind of run down. And the third week out, like, I'm getting a little lightheaded. And then we'll check their hemoglobin, and sometimes their hemoglobin is too low, then we'll have to transfuse them at that point.
Okay, great. Our next question is from _Stephanie_love. She would like to know, do you offer chin lipo? And if you do, what kind?
Yeah, so, it's mostly the sub-jaw area that most people are concerned of, right? So obviously the chin is right there. Most people don't want chin lipo. Most people want submental or neck liposuction just to get a better jaw angle. And this doesn't make any difference what kind of liposuction you're using. You just want to create the result. The liposuction modalities are just tools, and you can use all the tools or some of the tools to get a great result. Sometimes I use ultrasound assisted liposuction, and sometimes I'll use power assisted liposuction. It doesn't make that much of a difference.
Okay, great. And then our next question, she would like to know if age plays a factor when it comes to determining who can have plastic surgery.
Yeah, so age is just a number, just like BMI is just a number. And we've done surgery on 73, 4, 5, 6-year-old patients. We've done combination tummy tuck, breast lift, tummy tuck, bra line, back lift. And they've all done great. You have to think about it. If you're 70 years old, for example, and you've always been healthy, chances are your genetics are predisposing you to good health, and chances are you're living a good life, like you're treating your body well. So those patients are almost routinely in great shape, physiologically. So now you can be a 7-year-old and you can have heart issues, lung issues. You got to check those things out, and you have to make sure that those are not predisposing components.
Okay, amazing. And then we have a question from Renea _16. They would like to know, if one travels 4 hours via driving to your surgery center, and then are they able to drive back once they are cleared by you?
Oh, yeah. We have patients that, come from, the East Coast, and they drive here. They take like a week to get here. They visit places. They have surgery, they stay here the appropriate amount of time. That's usually 2 weeks for tummy tucks and 2 weeks for most large body contouring patients or body contouring procedures. And then they'll drive back. It'll take you a long time because you're gonna want to stop consistently to get out, use the bathroom, address your garment, all that stuff. You're welcome to do so.
Okay, our next question is from Jocelyn Schneider. They would like to know, if I had a consultation and a quote over a year ago, how would I proceed to get a new one and book surgery?
Yeah, the best thing to do is just reach out to the staff, and unless things have changed significantly, they'll just requote you for current supply and operational costs and that kind of stuff. They'll update that quote. If you have changed a lot, like if you've lost a bunch of weight or gained a lot of weight, it's good to jump on a quick call with photos and stuff, or just send the photos just to update, because we may have to tweak things, up or down in terms of, time in the operating room, or maybe the procedures may have changed, maybe in the beginning you're needing a lot of lipo and maybe now you've lost some weight, now you need a tummy tuck, or vice versa.
Okay, great. And then when it comes to consultations, what kind of consultations do you offer?
We do both virtual and in-person consultations. I'm happy to do either one. Obviously, for people that are far away, it's easier for them to do a virtual consult. It's always nice to see people in person as well. Either one's fine. You can reach out to us through our social media components, Instagram, TikTok. You can also just do the old-fashioned way of calling our phone number, 855-377-3782. Conversely, you can also do our website, drrepta.com. There's a little virtual consultation button at the top, but you can click that and still get an in-person consult. We tend to book out consultations about 2 weeks, roughly. We book out surgeries about 2 months, plus or minus. We're located in Scottsdale. We're about 10-15 minutes away from the airport. If you're gonna get a hotel or Airbnb, you shouldn't be more than 5 minutes away from our office. We're surrounded by like resorts and hotels and Airbnb, so that's where all the action is anyways.
Okay, great. Well, I think that's all the questions that we haven't answered. So
thanks, guys. Well, I appreciate it. Well, till next time. We'll see you guys shortly. There. Thank you. Appreciate it.